Use anybody, so if we can crack on. Apologies. Alison, do we have any apologies?
Thank you, Chair. Yeah, we have apologies from Councillor Bennett, Councillor Palmer, and then from portfolio holder Councillor Nielsen, and then from officers Andy Baldwin and Ian Edwards.
Thank you. Any declarations of disclosable pecuniary interests or other disclosable interests? Anyone? None shown. Thank you. Confirmation of minutes of the previous meeting. Anyone? Any comments on those minutes? No? Wonderful. Can we take those as read then? Thanks ever so much. Thank you. Chair's announcements. You'll be happy to know I don't have any. Public participation. Have we got any? Excellent. Okay, so we'll move on to item number 6, quarterly performance report, first quarter. And I take it it's you, John, to actually lead on that.
It's not normally what happens. No, Edmund, not normally what happens at Scrutiny Committee, Chairman. Just straight into it. I think it doesn't need a presentation. Just straight into the report. I'm sure you've all read it, and I'm sure you've all got questions and comments to make. So let's just.
Okay, thank you for that.
That's all right.
Having had the guidance, would anyone like to comment on the quarterly performance report?
Mine is how good it is, in reality. How sound it is financially. We're fortunate with as Andy told us, about the investments and their return at the moment. But in a way, that's almost denying the fact that we've managed our finances, so that does give us a bonus rather than having to sort of fill a hole with it. So that's excellent. I certainly looked at we've got very few reds on there. The area that actually interests me perhaps more than most is in planning, and the one red on there as always is validations, and that almost is an irrelevance in it's the final outcome rather than the initial input that really matters. And the validations almost depend on the detail that's actually put in by the applicants, which is less controllable, although I understand that there are plans to get that more standardised. That's my memory of it. I can't see anything on there that I actually thought needed to raise any major concerns.
Same point, Chair. I was going to raise, so just to push a little bit further on the validation question. I mean, the pattern here is that it's been consistently below target, and I just wondered whether that there's a good reason for the fact that we just don't seem to have been able to pull that one up over time. In a sense, as has been said, it's not the most important performance indicator in relation to planning, but it would be nice to think that we were trying to address whatever the problem is that's been holding it back. Thank you.
Just in response to that point, Chairman, I think if the Director of Planning and Infrastructure was here, he'd say that there are plans to sort of, address that. So some people might say, and it's already been said, that it's that bit of the process, measuring that bit of the process, could be regarded as irrelevant, because if we're still getting green overall in determination, then but I think he would say no, let's leave it there, and he does have plans to address that. So in response to both of the points that were made earlier, Chairman.
Can I point out too, I mean, that's against our own targets, not against national targets. So compared with national targets, we're above that on validations. And again, I mean, one of the reasons I think is our officers have been a bit too tolerant of bad applications when they've been coming in, instead of rejecting them quite quickly and saying, get your act in order.
So I'd like to raise a couple of points myself. Sorry, John.
Just to say that over this last number of years, we've struggled a little bit with on the planning side, and we've now actually sort of, I wouldn't say, maybe it's an exaggeration to say turn the corner, but we've significantly improved to such an extent that the team have actually won this this award for the Planning Authority of the Year award. And I think that needs to be sort of mentioned over in Scrutiny, just to highlight the fact that we have come through a process whereby there were some difficulties, there were staffing issues. A lot of that has actually now been resolved. We've got the new director in there, and he's made a significant difference. So I think all the team and the director needs to be sort of recognised and thanked for all the efforts they've put in. So there's an upward trend on this, and as Dean has said, this is our own internal targets in terms of the validation process, and it's the only one red that we've got, and it's a red against the internal targets. It's not the national targets, so I think it needs to be put in context where that resides. So I would say well done to the planning team, and thank you.
Thank you, John. A couple of points for clarification, maybe just from my point of view. On the SWDPR, I noted that the requirement for 6,479 units is now 5,913. I wondered how we ranked against the 5-year housing land supply when we get the SWDPR in later in the year.
I would not be comfortable in answering that question in any level of detail, and I think I will ask the Director of Planning and Infrastructure to sort of do a written response to that question, if that's okay, Chairman.
Thank you.
My understanding of it is it depends on the inspector's interpretation of air supply, and particularly in South Worcester supply, whether they actually accept the ability to build out in that in terms or not. If they do, then we will have a 5-year supply. If they don't, then we won't. And that, I think, depended on that meeting on, was it last Tuesday?
Last Thursday.
Last Thursday. And I'm not aware of an answer as of yet.
So what I'll do, Chairman, if you're happy with that, is I'll ask the Director of Planning and Infrastructure to do a written update as soon as he knows something more following the meeting last Thursday.
Thank you. Obviously, a great interest to us all because we get badgered by this throughout the area, understandably so. If I may, we discussed briefly at the pre-meeting sickness rates, and we are where we are, and I've been given the absence management document, which is very encouraging, very comprehensive. I think it's an item to note, that is sickness levels, because I noticed that yesterday the Chartered Institute of Personnel Development, who was also reporting the sickness levels in the UK, which are on average the highest since they started recording in 2010, they are pointing to worries within the Employment Rights Bill that is going through Parliament at the moment. And the worry is that with immediate access to sick pay, for example, sickness rates may go up. So I think it's an area that we might like to keep an eye on. Additionally, in the pre-meeting, we had a question on the food waste collection, and John, you said you might be able to give us a brief up to the minute on that.
Not tonight, Chair.
Not tonight, okay.
We'll chat with Ian for a while.
Okay, thanks ever so much, thank you.
Okay, so we'll ask Ian, the Director of Economy and Environment, to do an update on that. What I can tell you is that the revenue money for the ongoing service will probably be announced as part of the local government finance settlement in December of this year, or certainly the latter part of the year, which is quite late if the implementation date is April of next year. But we'll ask Ian Edwards to do an update on that for circulation to the members of the committee.
Thanks ever so much. Have we finished on agenda item 6? Any more points on that? In that case, we'll move on to Christine with Scrutiny Committee.
So, thank you, Chair. There's been some big news today, so I'm going to go through what you may or may not know about our local hospitals. As you may already know, the National Oversight Framework is a new way of assessing the performance of NHS trusts against a range of key safety, quality and efficiency measures. It was confirmed yesterday afternoon that those measures will be published nationally for the first time today. And I think those of us that have seen the news will have seen that it's top of the news. And will put each NHS organisation into a segment. These segments range from 1, highest performing, to 4, most challenged, with an additional segment 5 for those trusts who are identified as needing the most support. Today's rating puts our trust in segment 4. We are not one of the trusts going into segment 5, provider improvement programme. In the league table of acute trusts, we are placed at 110 out of 134. So this is bad news for us. So I've got a huge amount written here, but I've tried to sort of take some bullet points for you. So that's the big headline news, and HOSC has actually reacted to that today, not publicly, but shared with us. So this is what the Vice Chair of HOSC has said today. The latest NHS performance ratings place Worcestershire acute hospitals among underperforming trusts. The National Oversight Framework has put us in segment 4, most challenged. Combined with previous CQC findings, this raises serious concerns as we approach the winter period. Key concerns for winter: A&E overcrowding and long ambulance handover delays, limited bed capacity and unsafe corridor care, implementation of Martha's Rule under winter pressures will be difficult, workforce shortages and staff resilient risks, infection risks from flu, COVID-19 and novovirus, weakness in governance and leadership accountability, poor financial stewardship with inadequate rating. So you can see that that has come as devastating news, really, to local residents. So HOSC will be asking questions as winter's coming up, because that's going to be on the agenda. So to move on to HOSC, the agenda, the meeting was yesterday, and the topic, the main agenda item, was engaging neighbourhoods and communities. So I hope this is going to be better news for us all, actually, as Malvern Hills got singled out a few times, so that was good to hear. Thank Jen for that. So that representatives from Public Health, NHS Integrated Care Board, Hospital Trust attended the meeting. So they gave presentations. We also had a very thick agenda, which had narrowed things down. So I've tried to narrow it down even more so you get a taste of what was going on yesterday. So one thing that Director of Public Health often says is the power of community to create health is far greater than any physician, clinic or hospital. And that is really what's behind the wellbeing programme. Emphasises the significance of community support and engagement in maintaining and improving our well-being. It suggests that whilst medical professionals and healthcare facilities play a vital role in our health, the collective strength of a community can have an even greater impact. There is more to health than simply medical intervention. Communities provide an extensive network of social support that can improve emotional, mental and physical well-being. In Worcestershire, there is a significant amount of activity across the health and care system aimed at engaging and empowering local communities. Continuing the journey from consultation to genuine co-production and co-delivery, it is essential that these efforts to engage and empower are not tokenistic. So during the presentation, I was very proud that our efforts at District Council were named quite a few times. So it was good to be part of the praise, if you like. So some of these community initiatives: the Priority Neighbourhood Development Programme, Empowering School Communities, Worcestershire Engagement Network, grants and community development work are promoted through local connections, including working with district collaboratives, community empowerment through use of green spaces, libraries, engaging experts by experience, lived experience advisory network, volunteers in Health Watch, hospital services transformation and volunteer engagement, excuse me, neighbourhood integration and mental health innovation. That is just to name just a few. So there's an awful lot going on and we are part of that. Now, one of the questions that was asked was, well, a concern that was asked, and it was asked by Councillor Wells, is how's local government reorganisation going to impact this? So there was concern about that, and he was quite hard-hitting about it, that this programme carries on despite what's happening in local government. So can it just keep on continuing? So that was something that was raised. So the HOSC is responsible for scrutiny of local NHS bodies and health services, including public health. So for a few upcoming agenda items are winter planning, and this has been a worry now about the winter planning. So that will be coming up soon. Pharmaceutical needs assessment, ICB update, one that I'm particularly keen on and got rolling when I was Vice Chair is update on access to GP appointments and services to include our out of hours and urgent care. And I managed to get that bumped up the list because I've made a nuisance of myself, basically. Neurology, and then etc. etc. So that's the next few months. But obviously, what I was saying right at the beginning is going to be the biggest concern of the HOSC. So that was HOSC in a very tiny nutshell for yesterday. But on Thursday, I will be attending a conference in Hereford focusing on the role of community in preventing ill health. So it's been a busy week for your representative on HOSC. So that's it, really.
Okay, thank you, Christine. I think it's we're getting a series of hard news items, and this morning's was particularly shocking, worrying for our area, and especially against the background of what the government is doing, also, with local government reorganisation, but also with reorganising the ICBs. The ICBs, as you know, will have their funding cut by 50% next April. This seems to be, I don't know, it's almost like the government's causing a problem it's then reporting on in some cases. So I think it's a difficult time and something that we'll need to keep an eye on behalf of the citizens in our area. Okay, thanks ever so much, Christine.
Can I just say that Andrew and I have agreed to work together, well, we did right from the outset, but also we've asked Jen tonight if she could brief us, so we've got things going from MHDC the other way. So if there are any concerns.
Council's forward plan, any? Sorry.
Before we actually go on to that, I did bring up at our ONS briefing because Chairman's forward plan is the next agenda item. Yeah, okay. So still on number 7, Health Overview and Scrutiny Committee. I did bring up at our briefing the other day that I was a little bit concerned about the health and well-being of children at schools with this Brace for Terror lockdown, which you've probably all heard about. And it's sort of being rolled out to schools, which I agree. I think, it's a good idea, where the children are sort of told to hide under the desks because, there's a big nasty dog outside and what have you. Or words to that effect. But my concern is that this, as it's going to be rolled out, this needs to be done sympathetically, and we need to be aware as to how it's actually being handled in the schools. I did hear that one school in my area told the children to hide under the desk. One of the children said, because they said that there was a big bad man outside, whether that was actually said or whether that was what the child said. I need to actually find out and, investigate that. But what I'm saying is that because of the health and the well-being of the children, I think it should be sympathetically done. And I think us as a council should possibly keep our eye on it, or at least be aware of it, because these little frightening moments can stay with a person from childhood to adulthood. Okay.
Thank you, Barbara. My apologies. I'd actually tacked this on at the end of Overview and Scrutiny work programme. And no, it's absolutely okay. But while we're on it, we agreed, and Paul Bennett volunteered that he would actually take this forward to county to actually discuss with them. We discussed with Christine whether that was a possibility and whether it was appropriate at Christine's committee. Maybe not, but yeah, but certainly Paul was taking this forward for county. County is education.
Okay.
Barbara,
Yeah.
I've taken it forward as well.
You have, thank you.
I've given, Natalie is going to be looking into it because she's chair of families, children's services. So she knew what it was you were referring to.
Yeah.
And so I haven't yet thanked her for taking it on, but she'll definitely be looking into it.
Okay, and then it's also going to be on the forward plan, is it, or maybe?
Yes.
Or, yeah.
For report to come forward.
For report to come forward. Okay, thank you.
Can
I'd suggest we hear from Natalie first before deciding whether or not there's something for us to consider as a committee. So I think that'd probably be more appropriate, Chairman, at this stage.
Yeah, thanks, Chair. And thanks, Christine, for the report on HOSC. About three, 4-ish years ago, HOSC there was a task and finish group on CAMS, and there were big issues back then about CAMS not functioning properly. And that task and finish group produced a report with a number of recommendations on it. I'm not aware that what recommendations were actually implemented, and I think there's been a recent assessment of that report and what was implemented. So I wonder, in your capacity at HOSC, whether you could sort of find out what recommendations on that CAMS report have actually been implemented. CAMS wasn't really fit for purpose back then, but I haven't heard whether that has changed in any way, and it would be useful to know that.
Just a quick lightening of the gloom, perhaps. I don't know. I was listening to a radio report on the way over, and they got I don't know, the matron, the leader, whoever it was of the health authority that came bottom. And she was new into her area, into a hospital. And she'd said she'd never worked in a RACS hospital before, where you've got pillars holding up the roof and whatever. So a lot of this and rankings of it depends on really the circumstances. I suspect one of the circumstances of our hospital, despite the fact that they built a dreadful hospital in the first place, is the fact that we're a very elderly community. So they've got more stress on it than somewhere where there's a younger community. So I'm not quite sure how all this ranking, and having seen it in schools, with Ofsted inspections, where you see a school that was very hard-working teachers, because it's in a school which is more deprived and therefore has greater problems, whereas a nice little middle-class school has, they're all a year ahead of everybody else. And I've seen it literally when I've been working in various schools, because they've got an awful lot of parental support. So I'm not sure how useful these sort of gradings in the end are. They might be useful in providing a bit more support for those that do have worse circumstances. But if it's a matter of blame, then I don't think I'd say it is useful. One of the other things I think, although again I've seen some utility in some ways for it, but the fact that we went from a national health system that was based on cooperation into one that went into competition, I think did more harm over the last 15, 16 years than anything we've had. So instead of everybody working to work out the best solution, you worked out the cheapest one. Not the best, although again, in some ways, when this thing where you have your eyes sorted out and chopped about, that seems to have worked in that case. But generally, I think if we get back to more cooperation rather than competition in this circumstance, in a health circumstance, I think it'll be better. So we'll see. But thanks for Christine for bringing that to us. But in some ways, I wonder how the validity of a government's examination is.
Thank you, Dean. Sorry, did you want to come back?
Thanks, Dean. I'll send the whole report that I got to you, and because it wasn't all bad.
No.
I think they're doing the same as they're doing with the Ofsted. They're broadening it out. But yes, there are still critics of this system. But our local NHS has identified where the problems are, and it's A&E, basically, and patient flow, and money. Haven't got the finance for it. So the top ones were actually the speciality hospitals.
Surprise, they limit how many going in.
So once we start breaking it down, but I thought I'd just bring you the hot off the press that they'd sent to us locally. I feel for them. but that's where we are, and that's the news that the public are getting. So the BBC have covered it all day today. So I'll send you all a copy of the actual report.
Thank you. I think just to add, if I may, just one more comment. The health service problem, if we call it that, is multifaceted. I read another report today on the government's desire to make the health service effectively GP focused. That's the first line of defence or treatment or whatever, and that service is losing doctors at quite a rate at the moment. But the other thing that was striking in this article I read by a surgeon was that the main problem was that most GPs now work part-time. There are all sorts of reasons for all these things going on. However, it's, as I say, it's a multifaceted problem, and it's not going to be solved quickly. And all the indications are that it may well get worse.
Might be a surgeon's perspective on it, as somebody with a daughter-in-law and GP who works part-time, 12-hour days, 3 days a week. I think that probably is sufficient for most people to actually do a sensible job, like, you know.
You pays your money, takes your choice. I also know doctors. Sorry, we're going to move on. One of the other topics we discussed in outline at our pre-meeting were to look at the mechanics and policies of our evaluation procedures, really, for affordable housing. And because of the rules on affordable housing, which can cascade premises availability outside our area, the basic question, are we doing the right thing? And we thought we might kick off that debate if we're able to have a report from Jen on the mechanics that are currently in operation, and then we can actually debate on that framework. Thank you. Any other points to raise? I anticipate that my voice is loud enough, but obviously not. Yeah. I think we're on target to have a nice evening. Any other points to raise anywhere? In that case, may I thank you all and draw the meeting to a close. Thank you.